Good evening, everybody.
Good evening, Commissioner. My beloved sisters and brothers, respected ladies and gentlemen, my name is Wajdi Saeed. I'm the president of the Muslim Educational Trust. I'm also one of the co-founders of the New Portland Foundation. Tonight, we are discussing an important topic to our community, the vaccine distribution and the organ minorities. We are very thankful, to our Creator, the most merciful, the most compassionate, to have so many wonderful leaders in our community, in public life, as well as in community-based organization. About a month and a half ago, I read my beloved brother, Steve Dean, that we have followed and has been inspiring us in the Oregonian about the no relief, for the Rockwood community. For me, as an immigrant by choice, I was born in Yemen. I came 33 years ago. I was inspired by my beloved mother that took care of me. I lost my father when she was 6 months pregnant on me. My beloved brother, Ahmed, the late Ahmed Saeed, he went to Cornell to study economics, and then he finished his master's and PhD at University of Chicago. And Milton Friedman was his chair of dissertation. Writing a book about my brother, Ahmed Saeed, Beyond His Time. We grew up in Yemen, the beloved Yemen, where everybody belonged, to a native that we are proud of, that we are the children of the Queen of Sheba that ruled south of Arabia and ruled also East Africa. Growing up with 9 sisters, inspired us, to know and understand the challenges of single mothers. Today, my beloved sisters and brothers, too often the immigrant and refugee and the minority communities are marginalized communities, are left out of the civic engagement process and discussion. Tonight, you will get to hear from the state and the county leaders address the concerns of marginalized communities. Through this dialogue and discussion, we hope to find solutions and build trust between civic leaders and marginalized communities to heal and unify our public square. One of our greatest advisors was Nuhad Tolan. He was the founding dean of the College of Urban Planning at Portland State. Nuhad believed in America. He believed in America from within. He didn't believe America, the foreign policy. Most of our sisters and brothers in the immigrant and refugees came not by choice. They came because of displaced, by our foreign policy. But it is very important, the moment that we are in, we have to compete. We have to learn English. We have to compete with native speakers. We have to compete in colleges. We have to compete in every single aspect. The inequities that existed before COVID-19 have been exacerbated by COVID-19. Many times marginalized groups are told to wait and that the next time will be our turn. This has to change. An effective vaccine distribution and engagement process can help integrate immigrant refugees to be proud Americans, to be a proud civic leaders, to be proud taxpayers. It is very important, my dear sisters and brothers, to understand that there are so many individuals today that want to be part of the solution. This is why we have our beloved sister-elect, Commissioner-elect Carmen Rubio. We have our beloved sister, Commissioner-elect Nafisa Fai, our beloved sister, Sushila Jaipal, Commissioner Sushila Jaipal, and so many people that have compete and they want to be part of this great America, the America that we live within, the America that is loving, the America that is caring, the America that is public life is matters, the America of building bridges of understanding, the America of the beloved community. America was built by, the genocide of the Native Americans, the slavery of African Americans. It's time that America understand that we are one humanity and one race, and all of us are the colors of God. Without further delay, I would like to welcome my great mentor, my beloved brother, Sho Duzono. Sho has been part of the healing process as an immigrant. He came when he was 10 years old to a Japanese family, and now Sho is the chairman of the New Portland Foundation. Mr. Sho Duzono, our beloved brother, welcome aboard.
Thank you, Wajdi Saeed. Thank you very much. As Wajdi said, I came to Portland, Oregon in 1954 as a 10-year-old. My mother was born in Portland, Oregon, so I claim my heritage in Oregon through my mother. My brother, my sister, and I came to this country in 1954 as immigrants, and I did not speak a word of English when I came over. I can't speak it very well now, even now, but my Japanese was my mother language, and English was my second language. I went to local school here, Cleveland High School, went to Portland State, got my master's there. Before that, University of Washington, got my undergraduate there. So I had to apologize to Oregonians. I left the state for a better university in Washington, but that's an inside joke for me. And I've been active in my community through my business. I ran Osmona Travel for about 35 years, 1971 to 76. I taught at Grant High School as a history teacher. Left that business in 1976 to join my father-in-law's travel business, Osmona Travel, which I ran until 2016. And we ran it with one of the largest travel company in the region and one of the largest in the country. So I had the opportunity to be involved in business here in Portland and throughout the region, West Coast. In 2001, I probably got some recognition for leading 1,000 Oregonians to New York City after 9/11 tragedy. That propelled me into becoming Chamber of Commerce president, first minority in 110-year history. So I've been around a long time, and so people don't realize my immigrant background because I've been here for so many years that they don't understand that I'm an immigrant like the new arrivals are coming even today. So I'm very happy to be the current chair for the New Portland Foundation, trying to focus on the plight of the new immigrants and refugees who have in our community today. And today's conference is about the plight of the African American, Native American, Pacific Islanders, Hispanic people have been more than two and a half times more than the average white majority impacted by COVID. So that's one of the reasons why we want to have this conference to talk about the plight of brown and black folks. So I'm happy to have all of you here joining us, and hope that you'll recognize New Portland Foundation. You see on the screen about our effort to bring more people together. I think there's a picture of Commissioner Nick Fish and Wajid and so anyway, so this is our new board here. Jack Hanna was an implant from Pennsylvania, former head of the Democratic Party of Pennsylvania. Blake Gould is the and Paulo Arano Katlani is the current executive director. Hector Pinoza, well-known Hispanic leader in the community for about 60 years, I think. He's not as old as I am, but he's been in a long, long time. Alan Euler, that was head of the Mormon church in the region. Michelle DePaz, the current on the school board, Portland here. Melissa, who is an attorney in the Hispanic community, and others. So we're hoping to find younger people to join our board. And I think you'll hear more about our foundation as we really get off the ground here and to be engaged in the community. So I'm so very happy to be one of the co-sponsors for tonight's evening. So I'll turn this back over to Wajdi or Paulo Katlani. Thank you for your attendance.
I want to thank our co-sponsors tonight, the Coalition of Community of Colors, Central Cultural of Washington County, Latino Network, Unite Oregon, Race Talks, First Vancouver Baptist Church, Ecumenical Ministries of Oregon, sponsored organization to assist refugees, Africa House, and the Urban League. Last but not least, the Urban League. I want to thank also my beloved sisters and brothers, the elected official, Ms. Sushila Jaipal. Sushila, thank you very much for being a great healer and unifier. My dear beloved sister, Pam Therese, we welcome you on board. My beloved sister, she's a healer here and unifier in Washington County. And my beloved brother, Mr. Pat Allen, the director of Oregon Health Authority, and my beloved sister, Jessica Gerency, the director of Multnomah County Health Department. Thank you very much. I will leave now my beloved brother, Paulo Catalani, one of the greatest teachers in our community. Paulo has been inspiring and he's been unifying in my life for my 33 years here in Portland, Oregon. Paulo is a poet, he's a creative writer, he's an attorney, he is a source of healing to so many communities. Paulo founded, ERCO, and he founded APANO, and he founded so many other organizations, including the New Portland Policy Commission at the City of Portland and the New Portland Foundation. Paulo, thank you very much for being great, for being inspiring, for being a great teacher. Paulo now teaches at the Oregon Islamic Academy Creative Writing. Next moderator is my beloved sister, Juwairia Said, Dr. Juwairia Said. She's a Johns Hopkins graduate in genetics. She's the chair of our STEAM program, Science and Technology, Engineering, and Art and Math here at the Muslim Education Trust, Oregon Islamic Academy. Juwairia has moved from Virginia, and she is now claiming to be a Portlander, to be an Oregonian. Thank you very much, Juwairia. May God bless you, and Paulo is yours now. Thank you very much, everybody.
Paulo, before you start, I want to thank Steve Dean for joining us. I know Waji mentioned him already, but his article in Oregonian about the plight of the people in East County, Monroe County, not getting any support from the government spurred many of us to think about the plight of the immigrant refugee community. So Steve, thank you very much for your inspiration.
Yes, and thank you,
Paulo.
Stephen. Thank you, Stephen, for taking care of our families and giving voice to folks in our many Portland communities for as many years as you have. I imagine it must be 30, 35 years or so. You have done your work, very close, very tight journalism and commentary for Oregonian. I think Brother Waji overstated some of the teamwork I've been involved in, but I thank you for your generosity in any case. I also thank Sister Juwairia for helping me bumble through this next couple of hours. And I think it would be healthiest and happiest for everybody if she kicked us off by introducing some of the really terrific community leaders, policy leaders, and alike who will be joining us tonight. Sister Juwairia.
Hello, everyone. Welcome to our event, and I really like to thank everyone who took the time during their holiday break to attend this event and to be part of it and participate. I'd like to especially thank Commissioner Sushila Jaipal of Multnomah County and Commissioner Pam Trees of Washington County, and Mr. Pat Allen of OHA, and Ms. Jessica Grusny, Public Health Director at Multnomah County, to be the panelists and for tonight's event. Brother Paulo?
Okay.
We have the two videos from greetings from our Senator Ron Wyden.
That's right. We have
Congressman
Rod Wyden
Bumanichi.
and Congressman Bumanichi. Did you want to run those now to enlarge?
Yeah, please, yeah. Alvera? Vera, we are missing the audio.
Trust is an enormous community asset and one that has played a key role.
Can you bring it back, Alvera, please?
Good evening. While I can't be with all of you in person, I do want to acknowledge first the incredibly important work that the Muslim Educational Trust has been doing throughout these incredibly challenging days. The Muslim Educational Trust is an enormous community asset and one that has played a key role as Oregon works to curb the pandemic. And now we have the opportunity to use approved vaccines. From the start of this extraordinary public health crisis, my top priority has been to ensure vaccines are safe, well regulated, and equitably distributed. Now is the time for our community to come together and make sure that everyone understands that our priority is to make sure that everyone can get the vaccine. It's especially important that communities without power and clout in so many instances are prioritized in the rollout of the vaccines. Please know that I am here to support this effort. I'd especially like to thank Wajdi and the Muslim Educational Trust for holding this very important conversation, and to thank them for hosting the numerous other webinars they've had that are like this one. And especially important is the fact that I want you to know I'm so looking forward to the day, as we've done in the past, where we all can safely gather in person.
We are very thankful to our Senator Ron Wyden, for being always gracious and kind, to be always supportive. And he apologized not to be in person, but he has been busy and he took the time, to record for all of us, such an important message. We're very thankful to his staff and his team here in the Oregon office. Congresswoman Bonamici, also, she is in vacation, but she recorded for us a message of greetings and love for all of us.
Greetings, everyone. I'm Congresswoman Suzanne Bonamici, and I represent Northwest Oregon in Congress. First, thank you to the MET for going above and beyond to serve those in need during these incredibly challenging times. I appreciate your work to help those affected by the pandemic and to make sure that Oregon's census count is accurate and complete. And thank you for continuing to lift up Muslim voices in the public sphere. The strength and resilience of this community is impressive and inspiring. The pandemic has made it even more clear than ever that our health and economic well-being are deeply connected, and it's also laid bare long-standing inequities and systemic racism. In Congress, I've worked hard to pass additional relief for Oregon families harmed by the pandemic. I was relieved to finally secure more support for healthcare, cash payments, unemployment relief, and other aid for businesses and schools just last week. However, we know much more is needed, and I will continue fighting to help our communities rebuild and rebuild more equitably. I've worked throughout my time in Congress to address systemic racism and xenophobia and to stand up for religious and ethnic minorities. I applaud MET for convening today's conversation about a particularly important question at the intersection of these two topics. How can we make sure that the COVID vaccination campaign is transparent and equitable? How can we make sure that the voices and concerns of underrepresented groups are listened to and that they are heard? We are fortunate to have several safe and effective vaccines against the deadly COVID-19 pandemic. 2 have been approved so far. In the relief package Congress passed last week, I fought for urgently needed funds that will accelerate the free distribution of safe vaccines to as many people as possible, as soon as possible. Now the state must make these important decisions, how to prioritize affected groups. In doing this work, the state has an opportunity to center equity and to earn the trust of marginalized Oregonians. To inform this critical work, the state is convening a COVID-19 Vaccine Advisory Community Council, and that's made up of advocates and representatives from community-based organizations. I understand more than 600 people applied to serve. That's a good thing. Forums like the one you're having right now are so important, and I encourage you to continue your engagement throughout this process. Our communities are deeply interconnected, and an effective vaccination campaign will use the best available science to make those who are most at risk of infection the top priority. As vaccinations progress, we all have a responsibility to do our part by getting vaccinated when it's our turn, and making sure that those around us have accurate information. When it's my turn, I plan to get vaccinated, and we'll discuss that experience to help build trust and spread the word that vaccination is safe, effective, and important. So thank you again to the Muslim Educational Trust, to the New Portlander Foundation. Thank you for convening this important discussion, and I look forward to continuing to be your partner in Congress for equity and justice. And I wish you all a very happy and safe New Year.
Thank you very much to Congresswoman Bonamici and to her team here in Portland, Oregon. We are very thankful to have such wonderful leaders like Senator Wyden, Senator Merkley, and Congresswoman Bonamici, and so many other elected officials. Paulo and Joelia.
Thank you, Brother Wajdi, and thank you, Congresswoman and Senator, for these messages. Before we begin our panel discussion, I'd like to introduce our panelists again and our community leaders who are present here with us today. Today, our panelists are Commissioner Sushila Jaipal of Multnomah County, and Commissioner Jaipal is the first South Asian to be elected in Oregon or in the Western US states. Commissioner Pam Treese of the Washington County Board of Commissioners, and she serves the District 2 in Washington County and is born and raised in Portland, so she's Portlandian through and through. Mr. Pat Allen of Oregon Health Authority. He's the director there, and Ms. Jessica Grusny, who is the public health director at Multnomah County Health Department. The community leaders who are so gracious enough to ask some of the questions later today are Commissioner-elect Nafisa Faye, Commissioner-elect Carmen Rubio, Donna Maxey, Casey Jama, Steve Duane, Maria Rubio, Veronica Leonard, and Marcus Mundy will be speaking later on as well. So I am going to start off the panel discussion with Commissioner Sushila Jaipal. And Commissioner, my question to you is that what has Multnomah County been doing as far as preparations for distributing the COVID-19 vaccinations? And what are and how the county has been addressing or plans to address the inequities between communities during the planned vaccinations, as well as in general during these challenging times? Commissioner Jaipal?
Thank you so much, Joaria. And before I dive in, thank you to MET and the New Portlander Foundation for convening this conversation. I can't think of a more important conversation to be having right now than this question of equitable distribution of the vaccine. And I also want to really appreciate, Wajdi, your powerful introduction, and also the fact that both you and Sho shared a little bit about your journeys here to the United States. So I want to follow your example and just very briefly talk about my journey here. Excuse my computer for pinging as I talk, which is, as some of you know, I too am an immigrant. I grew up in India and Indonesia and Singapore and came to the United States when I was 16. And so what we're talking about here in terms of equitable distribution, making sure that our Black, Indigenous, and immigrant communities get access to this vaccine as they should and as they deserve, is one that is deeply personal and that I connect personally to. So I'm going to talk a little bit about generally about the values and the strategies that have guided Multnomah County's response to the COVID pandemic generally. And then Jessica Guernsey, who is the director of our public health department, will talk more in detail about how those values will translate into implementation in this phase of the pandemic. Remembering always that it's exciting as it is that we have a vaccine, it's the light at the end of the tunnel. That continues to be a strategy that we've got to layer on top of all of the existing public health work that we do and that we have to continue to do: testing, tracing, wraparound support. So with that, I'll back up and say that we at Multnomah County recognized early, I think very early in the pandemic, that COVID was going to exacerbate, as others have said before me, all of the existing inequities in our system, and that our Black and Brown and immigrant and refugee communities were going to be the most impacted. The way that we structured our response throughout has reflected this recognition. From the earliest days, the guiding value has been inclusively leading with race. What does that mean? It's meant several things. It's meant that we've been explicit about the racial and ethnic inequities we were seeing in the burden of COVID, not only the disease burden, but also all of the other consequences: economic consequences, cultural consequences, social consequences. It meant being clear about the fact that these inequities are created by racism and discrimination, not by culture or identity. It meant centering the most impacted communities in our work. If you go back through the briefings that Jessica and our public health team has given to the Board of County Commissioners throughout, you'll see this value called out from the very beginning. It meant making data a key focus and driver of the work. And it meant engaging with and investing in our community partners to create culturally specific strategies to support our community members as they navigate the pandemic. I'm going to talk a little bit more about the data piece and about our community partners because they are so critical to translating those equity values into the actual work. Beginning fairly early in the pandemic, we assembled a Black, Indigenous, and people of color data work group. And in collaboration with our sister counties, Washington, Clackamas, and Yamhill, we created a regional COVID dashboard that broke out the data across a number of domains. It showed numbers and rates of positive cases, hospitalizations, deaths, and access to testing, all disaggregated by race and ethnicity. What the data showed us won't be surprising to you, but it was important information to get out into the public at that very early stage. It showed clearly that certain racial and ethnic groups were disproportionately burdened, and that those racial and ethnic groups also had the least access to testing. We've used this data to inform our testing strategy. Our public health department provides only a small portion of the overall testing capacity in Multnomah County. The majority is provided by private systems, but it's a significant portion of the testing available to people of color. We specifically have prioritized testing for Black, Indigenous, and people of color. It's available regardless of documentation or immigration status. We set up our test sites also in response to what the data was showing us based on geography, East County, Mid County, North Portland, where we knew people of color and our immigrant communities were more likely to live. And we operate them with familiar, trusted community partners, IRCO, Latino Network, Portland Community College. We've also set up one-time only testing sites in locations or communities experiencing specific outbreaks, including, for example, at specific apartment complexes that are home to large numbers of immigrant families, at Self-Enhancement Inc. in North Portland, and in the Cully neighborhood in partnership with Hacienda CDC. Because of these strategies, again, driven by the data, the proportion of people of color that we test is high relative to overall testing in Multnomah County. About 40 to 45% of people that Multnomah County tests are Black, Indigenous, and people of color, roughly double the percentage getting tested across the region. The other critical piece of our response, as I said, has been our partnership with culturally specific community-based organizations and culturally specific liaisons, both to inform and to implement our strategies. This too will carry through to our vaccination work. We currently partner with and fund 17 culturally specific organizations to provide wraparound support to people who have to isolate or quarantine. And those wraparound services are crucial because, as all of you on this call know, our essential workers in communities of color and immigrant refugee communities generally don't have the luxury of working from home and so risk losing their income when they isolate. As proud as I am of the work that Multnomah County has done, and I am proud of it, to create an equitable, inclusive response, I'm also well aware of the gaps that continue to exist and of the need to continuously improve. Many of you have reached out to me and my fellow commissioners in our public health department as you've experienced those gaps. I hope you'll continue to do that, and I hope you'll talk about them today as well. In particular, I think our longer term work that will long outlast this pandemic is to build and maintain those community relationships that have been so crucial, regardless of whether we're in a pandemic, so that they're solid and seamless and we don't have to recreate them when an emergency arises. So to wrap it up, and before I hand it off to Jessica, our core value throughout our COVID response and in our public health work generally has been to lead with race. We know that racism and discrimination have resulted in an unjust distribution of risk and of resource. And we're committed to the ongoing work of developing targeted, specific strategies to reach and serve each of our BIPOC and immigrant and refugee communities, all of that will continue to drive our vaccination response. Thank you.
Terima kasih, Commissioner Sushila Jayapal. Our next speaker, as Commissioner Jayapal hinted several times, is Jessica Guernsey. Did I say your family name right?
Guernsey.
Guernsey. Don't make it any
Correct.
harder than it needs to be. Jessica. And let me just introduce her in this way. And this way is how we are going to beat every pandemic coming our way. It will take less and less time for us to do that. And it's because of people at Multnomah Health Department, like Jessica, that will make this happen. As you all may know, she has been for 20 years at the health department, and she has been through really what would be almost a recipe for success given the tragedy of our global pandemic. She started in 2001 serving our communities, serving our families, and she began putting together a strategic plan back then for a regional influenza epidemic. That's 20 years ago. In 2009, during the H1N1 pandemic, she put those wheels at Multnomah County and those people, those drivers of those wheels into action, into motion. In 2014, I want to thank now personally Jessica and her department and Commissioner Jayapal, who was then not at Multnomah County, but we want to thank you, our families, from the bottom of our East Portland hearts and our far north Portland hearts, for stepping in when children were treating our children very, very badly at school. This is during the Ebola outbreak in 2014, 2015, and it was terrifying what was happening to our children who need to be at school learning, not dealing with cruel kid culture. Multnomah County Health Department stepped up with our mutual assistance associations from Côte d'Ivoire, from Sierra Leone, and from Liberia, and put some very firm messages out there to school principals about what we expect when people take care of our children all day long. So Jessica brings this community feel. This is one of our neighbors. This is one of our folks who lives with us, talks like us, thinks like us, cries and laughs with us. And we are so proud to have you managing our county's, our community's health effort, Jessica. So please, maybe that was everything you wanted to say about yourself and what you're going to do. But you also know, I'm sure you do, that our families are looking for concretes about when they're going to get served, how they're going to get served, and where. Commissioner Jayapal has brought up that many communities are not so well taken care of by community-based organizations because we simply haven't had the money to cover everyone. So can you give us a more practical view of what we can expect in the months to come?
Sure. Thank you so much for the lovely introduction. And thank you for the invitation to be here this evening. It's a real honor to spend several hours with you all addressing absolutely critical pressing issues right now and now and in the future. The questions that you all are asking, we were asking back in our response to H1N1 as well. And really this community component of working in partnership is really the foundation for a response, whether it's an emergency or the longstanding health inequities that we have every day around chronic diseases in the community. I also just want to say that I'm the person that you're seeing, but I hope it goes without saying, but I do want to say it. I'm part of a team that is working day and night to address these pressing issues, our public health division and partners, many of which are on the call. Some are funded partners, some are just partners that are working in the response. So I'm speaking to you all, but I'm part of a huge network of folks, like I said, that are working day and night to assure that this work happens. So I'm going to talk a little bit about our approach to the work, building on what Commissioner Jayapal spoke about, and then talk a little bit more about the specifics. And I know Pat Allen will likely be speaking a little bit about the state framework in which we're working within, and what that means for counties. So we are right now in a first phase of vaccine rollout that really focuses on healthcare workers. And that has 4 different tiers of work that we're involved in right now. So that's where some focus is going right now to help coordinate some of those efforts. Our role right now is really more one of assurance to make sure that we are covering those different phases of vaccine. And at the same time, as Commissioner Jayapal spoke to, what we are starting to do is engage Black, Indigenous, and people of color leadership that we initially engaged with in our planning that led to our testing capacity, our data interpretation, our community partnerships for wraparound support. Back in the spring, my boss and mentor, Ms. Rachel Banks, who's now the public health director, really led that effort with the chair's office to reach out to many of you to understand what was important, not only the what, but the how. And we're restarting that process in the vaccination planning for Multnomah County as well. The state, as was mentioned, does have an advisory board that is kicking off, I believe, next week. Some of you all may actually be on it. I have peers that are on it. So we plan to be feeding information that we are getting locally, like I said, from many of you, into that process to really get to the prioritization questions that are being asked among the group. So there are decisions that need to be made about the next phase of priorities. And our role in that will be, again, to look at the data and make sure that it is informed by what we're seeing in Multnomah County. As has been stated, we know there's been disproportionate impact among BIPOC communities. We also know we have some really clear geographic disparities. So for us, our role is to ensure that that is the focus of this next conversation. From that, we also will be having conversations about, much like our testing work, how is that going to work best in the community? We're going to be working with healthcare, hospital, and other partners to ensure that vaccine is disseminated, which is what we're doing right now. But we need to have the feedback loop from community leaders like yourself to understand how is that going to work best, given that we know that there's distrust in healthcare systems, government, and public health. There's historic atrocities that public health itself has perpetrated against communities. So we need to be in dialogue around what are the best venues and ways in which that we can distribute vaccine and make sure people are vaccinated. So that's going to be kicking off next week, where we'll be re-engaging our local partners. Again, knowing that there's a state process as well, we know that we have to do that locally because it isn't a one-size-fits-all solution. From that, we expect that we will have a variety of pathways that we'll need to consider, some of which may include us providing vaccine ourselves through public health and through our health department to ensure that we're reaching people. So that's always been a role of ours, is to look at where are people getting access, whether or not that's an actual resource issue or if it's an issue of trust. That's largely why we focused on some of our testing sites to ensure that we were partnering with community-based agencies that are trusted to reach out to folks to get tested. The last thing I'll just mention is communication. A big part of what we're doing right now, and again, I can't even count how many people are involved in this, both internally, community-based agencies that are just, again, on this call, critical partners to ensuring that we have bi-directional communication that is reaching the right people, not only in the right languages, but taking into consideration all of the specifics of different communities. That's a huge role that we've stood up. We've actually stood that up regionally in partnership with Washington and Clackamas County to make sure that there's broad and specific communication getting out to all the different communities. I think I'm going to stop there for a sec.
Thank you, Jessica. And yeah, if you could just hold on to the many other things I'm sure you need us to know, we will come back around and have those questions asked and answered, I'm pretty sure. Let me get back to Teacher Julia and our next panelist. Teacher Julia, I think you are muted still.
I am still muted, yes. Thank you, Jessica, and thank you, Paulo, for this. The next speaker we have is Commissioner Pam Treese. And Commissioner, I have pretty much the same question for you, that what has the Washington County been doing as far as preparation for distributing the COVID vaccines, and how the county has been addressing the inequities between communities during this planned vaccinations, as well as in general during these challenging times? Commissioner?
Thank you so much, and thank you for the opportunity to speak with you this evening. Before I get started into some of the work that's going on, and much of it is very similar to what's going on in Multnomah County that Commissioner Jayapal talked about and Jessica talked about as well. But I want to give a little bit of a landscape here. In Washington County, I was elected in 2018 in May and had the opportunity to sit in on many conversations throughout that year prior to being joining the commission in 2019. One of those events was the report that we received from, that we worked with the community of, or the Coalition of Communities of Color to put together a report on what was going on in Washington County in relationship to our communities of color. I want you to know at that time, the report was given, and I, even as a commissioner-elect, firmly stood up and said, we have to move forward with these recommendations. We have to do this. And I intend in 2019 and through my term to do that. What I'm so proud of is the information that we got from Marcus Mundy and his group, and how we have worked hard for the last couple of years to integrate that information into the way the county operates. We have 4 now new commissioners, relatively new commissioners. We are all in our first term, and our 4th is Commissioner-elect Nafisa Faye, who I am so excited will be joining us in January. We have a new county commissioner, a new county administrator that we hired this year, who has a strong focus in the area of diversity, equity, and inclusion. And most importantly to me, we have stood up our Department of Diversity, Equity, and Inclusion, and we've hired Latricia Tillman to head that up. Everything that we are doing now at the county goes through 2 lenses. The first and most important is the diversity, equity, and inclusion lens, but also through a transparency lens, so that all of our constituents, all of the people that we represent, understand what's happening. We, during this COVID time, as we've all talked about, it lays bare what your strengths and what your weaknesses are. There's no question about it. And I'm so pleased that we had the opportunity to put together a strong foundation before we entered into this horrific time, if you will. So with that, I'd like to share my screen and offer up this graph. Let's see if I can do that. There we go. And this graph will show you that this is a breakdown of our population and who has been affected by COVID. I think you can see at the top, our white community is, and by the way, this is in reverse alphabetical order, but the white community is about 72% of our population, but only 32% of our COVID patients or people affected by COVID. The biggest issue that we are facing, very frankly, is our Hispanic, our Latinx community, with 17% of our population They represent nearly half of those who've been affected by this pandemic directly. So, and you can see with our Black community, again, 3% of our population, but excuse me, 2% of our population, but 3% of those affected by COVID. This is not acceptable. And this is why we are working very diligently with our communities of our community-based organizations to help get out the word here. So I'm going to move to my prepared remarks here. So we've used a lot of strategies to reduce the inequities, including providing information in multiple languages, social media posts, funding our community-based organizations to provide outreach, education, PPE, and essential needs such as food and rent or utility assistance. And when I say we've been funding them, that's to the tune of over $13 million. So we've used our CARES relief money, the money that comes from the federal government, to really focus in here. We've also hired multicultural, multilingual disease investigators and contact tracers. As we finalize our plans for distribution of COVID-19 vaccine, we are once again making sure that equity is right at the front and center. Just as a refresher, we've already talked about this, but there are 2 vaccines that have received the FDA emergency use authorization, Pfizer and Moderna. Both are extremely safe and effective, over 95% effective, but both require 2 doses, 3 to 4 weeks apart. The CDC and Oregon Health Authority have developed the priorities for the distribution of the vaccine in these early stages until there are enough doses for each and every American and Oregonian who wants to be vaccinated. We are very aware that there are communities, especially communities of color, who may be skeptical about receiving the vaccine. There are many instances, as Jessica pointed out, of racial discrimination and frankly, abuse in our history and our not so distant past. We have a lot to overcome to help these communities feel safe and ensure that they have easy, culturally appropriate access to the vaccines. I'm supporting our staff as we move forward here, as we present this information, as we continue to, as Multnomah County, lead with race and make sure that we are prioritizing our populations that have had difficulty through this, even maintaining. I want to make a shout out here to Central Cultural. I know Maria is on the call here tonight. Their annual report came out today, and it's just incredible what that community-based organization has done in relation to getting the word out, to communicating, to supporting. And all of our, whether it's ERCO, whether it's APANO, we are all working together to address this issue. I'm looking forward to additional questions. I want to thank everybody that's on the call. It is so wonderful to see so many leaders here, people that I've worked with in the past. I noticed Vicky Nakashima is on the call. Sho DeZono, someone I've known for a long time. In fact, I was on his flight to the Freedom flight to New York City. So we've all worked together for many years. We must have this be a priority. We must be looking forward. We must continue with our communications plans, with our building of relationships, our working together, frankly, between the counties, as well as with the state. So with that, I thank you very much, and I'll be here for questions as well.
Thank you so much, Commissioner Treese. Thank you for your big-heartedness, for your broad-shoulderedness. And for folks who don't know, our families go back and forth between service areas, giving addresses of family members they have in the other service area they don't live in, because maybe, for example, a Multnomah County clinic off of Division Street on 82nd is completely generous and loving and caring to our families. And maybe someone will live in Hillsborough and drive over there and get service. It would be so wonderful if we have these faces that we see here today across counties, across jurisdictions, across communities, continue to talk to each other and provide services to folks who are really working very hard to integrate themselves into our existing systems. Thank you for your generosity, everybody. Let me introduce the Director of Oregon Health Authority, Patrick Allen. I've lost track of him here. I know he's, there he is, waving his arms. Thank you again for joining us. Are you living in Salem, Pat?
I live in the Portland area in Sherwood.
All right. I guess it doesn't matter that much anyway, does it?
I could be almost anywhere.
All right. Patrick Allen is a native Oregonian. Can you say which town did you grow up in?
I grew up in Portland, and in fact, I started my freshman year at Grant High School in 1977, meaning I just barely missed the opportunity to learn history from Shotozono.
Oh, well, it's never too late. Big Uncle Show is doing Saturday workshops on Oregon history because he is living history, right? He and his family. Patrick Allen's native Oregonian. Like I said, he has 25 years of public service, some of it, most of it in the state of Oregon for 6 years before his current gig at OHA. He was the director of the Department of Consumer and Business Services, where you've been since what, 2017, more or less.
I've been at OHA since the fall of 2017, yeah.
All right, and you are an Oregon State Beaver graduate sort of thing. Yeah.
Indeed, yes.
All right, I'm just trying to relate. You know, I'm working at this, my cross-cultural skills. Me too, by the way. Okay, so let me see. We have a question for you, and it reads something like this. I assume you have it in front of you, but for the rest of the folks here tonight. What has the state of Oregon been doing preparing for distributing the COVID-19 vaccine? How are the counties addressing or plan to address the inequities between communities during the planned vaccinations, as well as the other emergencies, the concurrent emergencies our communities are dealing with? So I think our county speakers have done a very tight job of explaining to us what they do and how they do it. Can you tell us about the state of Oregon's preparations for distribution of the vaccine?
Yeah, thanks for the question, and thanks for the opportunity to be here. I appreciate the trust and the foundation setting up this opportunity and letting us all really engage with you and listen as much as we talk about what we're trying to do. You've heard from Multnomah and Washington County the outstanding work that they're doing. It's maybe good to start this just thinking a little bit about how do the state and the counties relate to each other in this process, because we have kind of a system in the state that's got a role for the state public health division, the Oregon Health Authority, to help guide resources, set policy, those kinds of things, and then each of the county, or in a couple of cases regional, public health organizations are the folks on the ground who actually have the relationships and do the work day in and day out of responding not just to the pandemic, but to public health issues that go on day in and day out all throughout the year in normal times. And in those normal times, we start out as the 48th lowest funded public health system in the entire country. And so you see that show up when we start to try to deal with a pandemic. When we think about needing contact tracers for COVID, the people who do that work are the people who do it for tuberculosis or measles or sexually transmitted infections or those kinds of things. That's the same core skill set. And when we don't have enough of those people, it compounds itself in so many ways when we respond to a pandemic. So just a little bit about the difference in the two roles. I want to talk about three things that we've done to try to prepare. First is the prioritization work that I think both Jessica and Pam mentioned earlier. I'll touch on that. And then Congressman Bonamici talked about our vaccine advisory committee, and I'll spend a little bit of time talking about that. And then I want to talk about, believe it or not, good things that come out of pandemics that continue on into the future. And there's a little bit of that here as well. So first, in terms of prioritization, The Centers for Disease Control and Prevention set up kind of a very broad framework of what does prioritization look like for the pandemic, and they've created phase 1, phase 2, and phase 3, and they've divided phase 1 into A, B, and C, and they contain some very broad phrases like frontline healthcare workers, people in skilled nursing facilities, those kinds of things, and it really falls to us to figure out what exactly does that mean? Who is in those groups? And one of the first decisions that we made in this first 1A category was to be very broad in our definitions and make sure that we captured not just the people that you tend to automatically think of, for instance, as a frontline healthcare worker, a physician or a nurse, but to really broaden those categories to make sure we really capture everybody who comes in contact with patients or the things that patients have been in contact with and thus are at risk of contracting COVID-19. And so our definition includes not only the technicians and the licensed healthcare providers and professionals and those kinds of things, but includes housekeeping staff, nutrition staff, people who move patients from one part of a facility to another. And not coincidentally, those people are also much more likely to be people of color working in those positions. And so the intent was to make sure we first capture everybody who's in contact with patients, but second, in so doing, make sure we don't exacerbate the inequities that occur by not paying attention to all the different portions of that healthcare system. We also make sure, as we think about these definitions, to capture things like traditional health workers, healthcare interpreters, people who provide culturally specific healthcare services, including tribal-based practices, tribal health systems, and all the rest, to make sure that we cast a really broad net around what is healthcare, who provides it, who are they providing it to, and are we making sure to capture all of that structure. Similarly, when we go to skilled nursing facilities, we've made 2 decisions to broaden that category. We included all of long-term care in category 1A, not just skilled nursing facilities. We'll start in the first wave of 1A focusing on skilled nursing facilities and memory care facilities, because those are where our very worst outbreaks have been. Skilled nursing facilities, the residents are medically fragile, and in memory care, trying to maintain adequate quarantine and isolation is very, very difficult. And so that's our first priority, but we want to capture, when we go through the 4 categories of 1A, all of those long-term care aggregate residential settings, because they represent collectively about 40% of the deaths that we've seen in Oregon throughout the pandemic. But we're not only going to capture the residents of those facilities, we also want to capture all of the workers in those facilities, the workers, the contractors, the people who visit. Again, that workforce is overrepresented in communities of color. It's overrepresented in lower incomes. And so in so doing, we again try to consciously make sure that we're not exacerbating those inequities by not paying attention to the people who are serving the needs of that population. Now, by the time you do all of that and get all of those folks and a few others into category 1A, you're at somewhere between 300,000 and 400,000 Oregonians. So that's a fairly large number of people that we're now working our way through in terms of vaccinations. All right, so that's kind of the prioritization decisions we've made in category 1A. Takes up about 10% of the population. The governor has decided that education employees, again, broadly defined, not just teachers, but classroom aides, bus drivers, nutrition workers, all those kinds of things, will be the next round of people who will be vaccinated, and that's public and private, about 75,000 people. That leaves everybody else who needs to be prioritized, and that takes me to the Vaccine Advisory Committee. At the first of the year, the Health Authority had committed itself to a 10-year strategic goal of eliminating health inequity in Oregon, so by 2030. And we established a health equity definition that has, to me, a really, really key component to it, which is critical in achieving health equity, is allocating and reallocating resources and power to the communities that have not been appropriately served by our traditional systems, and that those inequities exist because of underlying structures of racism and genocide, both historical and present. Well, reallocating power is really what I want to talk about, because it really is a foundational decision in this Vaccine Advisory Committee. we decided not to do what I think entities like ours often do, which is not only take 1A, but let's do all the rest of 1B, 1C, 2, 3. Let's come up with a nice draft framework of everybody who should be prioritized, and let's go take it to a group of people and say, what do you think? And if they agree with us, listen to them. And if they don't agree with us, not listen to them, and go back and do what we as really smart professional people think is the right thing to do. We decided to actually not take that kind of a path at all. What we've done is create a committee. And as you heard Congresswoman Bonamici say, we had, I think, 670 applicants for the 25 positions on this committee, but they will be making the decisions effectively about how we'll do the prioritization for the rest of the subcategories that we need to prioritize to go through this process. I say effectively because the Department of Justice won't let them actually make the decisions. I think ultimately I have to make them, but the decisions that they bring to me are the decisions that the agency is going to make about prioritization. So we really are reallocating the power to this group, because this group is drawn from, again, the communities that are historically underserved by health systems in the state, disproportionately impacted by the coronavirus pandemic. They are the people who are from the communities that are bearing the brunt of this pandemic, and should be the ones at the table deciding how we're going to prioritize this resource. Just checking my notes real quick. And then the third, and then the other role that we want them to play vitally is not only to make these prioritization decisions, but help us in terms of communicating about the vaccine and its value and the importance of getting vaccinated. It's great for me to sit up in front of a TV camera somewhere and say, y'all ought to get vaccinated. But you've already heard comments about the terrible history that our medical system has around experimentation, around lack of trust, all these things that pile up on each other and make voices like mine and others in public health not necessarily the best voices. And so we really want this committee's help in messaging and in helping communicate to communities about the importance and the value of being able to get vaccinated to protect themselves and their loved ones. That brings me to the third and final thing, which is good coming out of the pandemic. We used funds from the CARES Act to do a couple of really important things you've heard. Jessica and Pam, I think both talk, and Commissioner Jayapal, all three talk about community-based organizations and their importance in responding to the pandemic. That's actually been a little bit of a gear shift for us as state public health and for many counties at the county level working with these local partners. And so we made a couple of big investments in community-based organizations to be on-the-ground partners in responding to the pandemic. We provided structural grants to about 180 organizations that allowed them to be able to do things they've not done before. In some cases, getting involved in things like contact tracing, certainly providing wraparound supports to individuals who needed to quarantine and isolate, and created capacity that didn't exist or wasn't as robust as it could have been prior to the pandemic. And then we added to that $45 million of grants that went to things that you could broadly call social determinants of health, but they were, what do people need to be able to survive through the pandemic? Food assistance, childcare assistance, housing, all those kinds of things. Well, what's good that's come out of this is that we're moving forward. The funding that we've been using, CARES Act for the structural grants, State General Fund for the Equity Fund, we're moving forward to the Emergency Board to ask to continue both of those. Now that the CARES Act appears to finally be renewal, appears to be moving forward, that's in good shape. We'll be asking for more State General Fund for the health equity investments. But these are also now built into the governor's recommended budget going forward. And so our hope coming out of the legislative session is that they become a permanent part of how we do business as state and local public health, working with these partners who are working in and are of the communities that have not been well served by our systems. And this becomes a permanent, I hope, improvement to the public health system, in large part because we had this experience going through the pandemic. I'll stop there and pitch it back to you. And now you're on mute.
Thank you so much, Director Allen. And Paulo, you're on mute.
Thank you. Thank you, everybody. There's about 12 people jumped at me at the same time. Thank you. Oregon Health Authority Director Patrick Allen. My brother Kesa Jama, Executive Director of Unite Oregon, will return to you with a more specific question later on in the program. We try to get us into some kind of forward momentum here, since it's now 7 p.m., which just gives us an hour for lots and lots of information, some really, really good people. But before we move on to introducing Marcus Mundy of Coalition of Communities of Color and Veronica Leonard of Latino Network, the Director of Education and Wellness, I want to make sure everyone sees below Patrick Allen is Neil Lee. And he's one of those people, if folks are not working with him, along with Kesa Jama, who's now the director of Unite Oregon, Neil Lee, and about 25 other really muscular, tough and tender Portlanders are what we call community mechanics. If you aren't working with Neil, who's just below you, Pat, at least in my grid, you need to be. He's pictured here in front of, looks like the Chinese Benevolent, Consolidated Benevolent Association's building, but he is the head of the local and the National Lee Family Association. This is how stuff gets done in our communities. And everyone knows stuff got undone in our Chinese communities almost the day after rumor came that this virus was coming from mainland China. So this is an opportunity to know who's actually doing the work in communities, if they're not with the community-based organizations recognized by our existing systems. So let me move on, please, as rapidly as I can, introduce Marcus Mundy, and teacher Julia will introduce Veronica Leonard. Marcos, I traded places with Julia so I could do this and mess you up in front of all these nice people. Marcus Mundy and I are both alumni of Howard University in DC and University of Oregon. It's true, every school I can get into, if they give me money, I show up and I get another degree. It's an immigrant thing. America has the best, cheapest public universities ever, anywhere on our pretty little planet. Marcus and his wife Leslie and their children moved here, him to KPMG, I think that's an accounting firm, and then soon after he went to Kaiser, and his wife was here after a job at Nike. As most folks don't know, because I think everyone knows Marcus Mundy is this guy who worked and worked and worked weekends and nights and hours we've never heard of with and for Urban League and now Coalition of Communities of Color. But what folks don't know is that his beautiful wife, the mother of his brave and bright children, passed away 3 years into Oregon, and Marcus took over as being pop and mom and all the other things we know him to do. A head of an organization, plus a community mechanic, one of those people everybody turns to and asks, who do I ask for help? So it's, you know, I'm so humbled. I'm honored to introduce our brother Marcus Mundy, who's now at Coalition of Communities of Color, and as several other speakers from both counties have said, this has been a game changer for our ethnic minority and newcomer communities to have an organization provide us the data for stuff we all know each and every day. We know it like we know getting out of bed, and we know it like getting out of bed at 11 o'clock to take care of our communities. Now it's in data form, and it's now something that's really irresistible, or so we pray, to the institutions serving our families and our communities. So Marcus, I no longer see you on my screen. I know you're out there somewhere. If you wouldn't just jump in, please, and start talking, then we'll know you're here.
All right. Well, Polo, it's good to see you. Thank you for your kind introduction. And I wanted to also thank what I heard from all the speakers prior to me, the government folks, the elected folks, I enjoyed all your comments. They're right on point and they're very important right now in this time. So I wanted to thank everybody and also thank Wajdi and MET for inviting me tonight. And also before I make my very brief comments, I did want to acknowledge the passing of a giant in our community who was actually very, very important and strong on culturally specific healthcare, Dr. T. Allen Bethel. He was the pastor of Maranatha Church, but he was a fierce advocate for healthcare in communities of color. And I just wanted to acknowledge that we lost a lion in the community, and he was a great man, and I was glad to have worked with him on several initiatives. So thanks very much for allowing me that grace. Aside from that, I would, someone earlier, I think it was Commissioner Treese, who had mentioned that, you know, in May of 2018, the Communities of Color report, but they had done that magnificent work on the Leading with Race report, which focused on Washington County. That they announced that report in June of 18, the day they announced that I was joining the coalition. So I take all the glory, but that was the hard work of the staff who preceded me, Danny Ledesma and our researcher Shweta. They did excellent work, but I worked with them ongoing after that. So I appreciate that. But both that report and our Multnomah County report, which all happened in the last decade, the unsettling profile, focused on the very healthcare disparities that we're talking about today, and that the pandemic has uplifted in a horrible but opportunistic way. So I did want us to, I encourage everybody to look back at those reports. There's no new news in there. It's the same, but now we have an opportunity to address some of those things that were pointed out in those reports. And I guess my purpose for being here today, again, I promised my comments would be brief, but it's very personal to me, this health equity conversation. And I joined at the behest of my brother Wajdi, because it's important that we all, you know, follow the science. We all get our vaccination when it's our turn. That's why I'm here today. The biggest thing, because my dad, a lot of you in the last 9 months have probably heard about the Tuskegee Experiment. Well, my dad was born in 1929 in Tuskegee, Alabama, where that took place. My grandfather but for the grace of God, he could have been part of that experiment. He was not, because he was a little older than the people, the men that they selected, the Black men they selected to run this 40-year syphilis experiment on. So, you know, there, but for the grace of God, because my dad was too young and my grandfather was too old, they could have been the victims of this inequitable, horrible experiment that was done on African-American human beings in Tuskegee, Alabama. But that's where my people are from, and that they were living there when all this was going on. So I'm very lucky just to be here today and not have been a victim of that, a heretical or hereditary, whatever, victim of that. So that's the only thing I want to say. I want to underscore that what all these healthcare professionals you heard from and these government professionals you heard from tonight are talking about is essential. I will do anything that the coalition can do to get the right information out into the community. And by the way, I wanted to thank Patrick Allen, because we're actually working on a research project with OHA right now, looking at the impacts and the effects of COVID on communities of color. We're doing a study real time, and my researchers are trying to wrap up before the end of the year, but that's going on real time. And the other thing I would share with Patrick Allen and others on the call, the state folks, is that the governor has put together a commission, this racial justice committee, and several of the members are on this call tonight. But I would encourage the members of that committee, particularly those who are on the health subcommittee, to not be redundant, to use what OHA is doing, have them report to that commission, have the commission give some imperatives to them back and forth, and use this moment to get the most out of the federal money, but the ongoing state money, if we're really gonna build in and weave in this health equity lens to everything we do. So that's my message. Just let's all work together. We will work with whoever wants to help communicate this message, and the coalition of communities of color is all in on this concept. So I will give it back to Brother Polo. Good to see everybody, and I hope to hear more tonight. Thank you.
Thank you, Brother Marcus Mundy. And so good to hear from the Coalition of Communities of Color to be part of this. And I'm really excited to learn about that research that you're doing with OHA. As a geneticist, it's piquing my interest here. So I'd like to be kept in the loop, inshallah, God willing. The next person, Veronica Leonard, is part of the Latino Network, which was founded in 1996 by community leaders who grew concerned about the lack of adequate resources to meet the needs of growing Latino community. Since that time, they have evolved to become an organization that also encompasses transformational programs aimed at educating and empowering Multnomah County Latinos. Veronica is the Director of Education and Wellness Department at Latino Network. I do not see Veronica on my screen, but I know she's here. And this is all yours, Veronica. Nice to meet you virtually.
Thank you very much for the invitation to represent and speak to the experience of my community, the Latino community in Multnomah, Washington, and Clackamas County. I'm extremely honored to be here alongside our panelists and other community leaders. And alongside Marcus, want to underscore that what you've already heard is really is what we have been seeing, and I will add in some detail around what Latino Network has been providing since the pandemic started. For those of you who don't know, we serve over 9,000 children, youth, and families a year. The bulk of our services are in Multnomah County. We've been out in Rockwood for over 10 years and are currently raising funds to build our first community center. We're really excited that we'll finally have a place to call home, where our community members will feel safe, will have the trust to come and get services, but also have a place where we can celebrate our cultural practices and be together in community and continue to build that resiliency that we have and that has helped us through this awful pandemic. Commissioner Jayapal spoke to how all of the speakers have already spoken to the incredible disproportionate impact that communities of color have faced during this pandemic. And I really want to underscore that for the Latino community, this has really been the hardest hit community, making up 13% of Oregon's population. We have consistently tested 38% of tests have come back positive for the Latino community. So we are really getting the brunt of the pandemic in our community. And why is this? This isn't surprising, right? Many of our community members are essential frontline workers. They work in agriculture. They provide, they work in food processing and delivery, grocery stores. They stock our shelves. If it weren't for our community members, many of us would have trouble accessing food during this pandemic. So it's really because of the Latino community and other communities of color that have jobs in this sector that we have been able to continue living our lives, but that has put them at an inordinate amount of risk. Our communities aren't able to work virtually in the safety of their home. They're out on the front lines, putting themselves at risk in job sectors that maybe did not protect them in the way that they should have been. So this is really why it's so critical that our community members get the vaccine as soon as possible, because by protecting communities of color in these essential frontline positions, we will then ensure safety for the broader Oregonian community, because our community members come in contact with other community members and could potentially spread or are spreading the disease. Another issue why we are so impacted in many of the communities of color is because we live in multi-generational households. And because of gentrification, we have been pushed into 1 to 2 bedroom apartments. How is it that someone living in a situation like this could successfully maintain isolation in their own bedroom with their own bathroom? It's just simply not possible. And so someone comes home from work who is sick, it then spreads throughout their whole family. And that is what we have seen again and again within the Latino community and within other communities of color. We also saw early on that it was really hard to access testing for Latinos and for other people of color. They were being turned away from testing sites for incorrect reasons. They already were facing so many fears and barriers of even getting to the testing that when they did and they were turned away, that really created a shock throughout the community for others to go and get tested. And so it was really exciting that we were able to partner with Multnomah County to provide weekly COVID testing at our Rockwood site. And we will continue to provide that as long as we need to really ensure that there is a site in Rockwood that our community knows and trusts and feels safe to go and get tested there. We're already in conversations with the county that when the vaccine gets rolled out to the broader community, we will be a site that will be able to provide the vaccine and are really excited to be able to do that. We've also partnered with Care Oregon and with the county to see how we can incorporate the flu vaccine, knowing that by getting the flu vaccine, we're protecting ourselves and the community and the healthcare system from being overwhelmed with additional cases of sick people in there. I want to call out one particular resource that Latino Network advocated really strongly for alongside a coalition of over 20 community organizations that really helped many Oregonians who were not eligible for federal stimulus aid and Oregon unemployment aid, and that was the Oregon Worker Relief Fund. This isn't directly linked to the vaccine, but I think it's really critical that we also talk about how creative Oregon has been in figuring out ways to make sure we are providing comprehensive support to our communities who may not be able to access the regular ways in which people were getting support from the government. The Oregon Worker Relief Fund provided support to people and families who were ineligible for unemployment due to their immigration status, and has provided millions of dollars to people all across Oregon. And that was because of community organizations such as Latino Network, such as CAUSA, and many, many others that did really critical work in Salem to ensure that we got access to those funds for our community members. In regards to testing, to messaging, and both Director Allen and other speakers have spoken to this piece, the critical importance of ensuring that both for testing and all of the safety measures and the restrictions that we have right now, but also more critically moving into the vaccine rollout, we ensure that our testing is culturally specific. What does this mean? This doesn't just mean taking what's written in English, translating it into all the different languages that exist in Oregon, but it really means thinking about what are the specific myths, what are the specific fears in each of those communities, and really getting to the root of that and making specific messages. So this isn't anymore just going in, getting a translator to change documents into different languages, but really working closely with community organizations, community leaders who understand what their community members are fearing and what they're hearing on the ground so that we can adapt messages. Early on, we recognized that this was an issue, both at county level and at state level. And we let our partners know at OHA. And as Director Allen mentioned, they invested quite a lot of money into creating of having a concerted effort to make sure they were not just translating, but they were transcreating materials and making sure that they were adapted to each of our communities. I really applaud this effort. I think we need to continue to do it, continue to really think about and get information from the ground of what those messages and myths are so that we can be best prepared and get ahead of the curve in the rollout of the vaccine. I also want to speak to
Renica, if you don't mind, we have limited time, and we just want to highlight the Latino community and other community challenges. We did invite our native indigenous people and so many other organizations and when we highlight, one community, we are basically highlighting everybody, And
Yes.
if you don't mind, Veronica, we give a chance to the rest of the questionnaires,
Thank you very much.
Thanks, Veronica. I want to applaud my beloved sister, Carmen Rubio, for building the Latino network and expanding it. And we are going to miss her and the Latino network, but we are gonna win her in our public square at the city council. Applaud, round of applause for you, my dear Carmen, for such wonderful work. One of the early founders, one of the early executive directors of Latino Network is a member of our community, Camille Emily Combe is from El Paso, and he's an elder now, 82 years old, that is a member of the Muslim community. May God bless him and bless all the leaders. Thank you, Veronica, for a wonderful presentation.
Thank you, Veronica, and thank you, Brother Wesley. Thank you, Veronica, for sharing the struggles of the Latino community. Then I am going to ask Commissioner-elect Nafisa Faye of the Washington County, also the founder of Pan-African Institute and first Somali American woman to be elected in Washington County, to ask the next question. Nafisa, it's so good to see you again and have you question and have you on a panel again. I think I saw Nafisa's name earlier.
Maybe she's trying to get her son to bed. And in the meanwhile, why don't I move over to Commissioner Carmen Rubio.
Yes.
Who's going to ask Washington County Commissioner Pam Treese a question. And I think Carmen Rubio has been introduced a lot through this last hour and a half or so. But let's just leave with this. We are so grateful to Carmen, to Carmen's mother and to her abuela, to her family who has come across borders, across generations, and landed Carmen at City Council. This is a wonderful new day, a new year. This is why we have the New Portland Foundation. Old Portland was not so bad, but old Mexico wasn't so bad, but then we had New Mexico, where maybe it rained a little more. And Old York wasn't so sooty, but now we have New York, which is giving us so much more promise and so much more hope. So Carmen, thank you. Thank you to your elders, to your ancestors. And Carmen has prepared some question for Commissioner Treese.
Thank you, Commissioner, for being here. And I would love to ask you a question about, in your experience, how do you see the community resiliency over time building in Washington County? And how do you feel like this will be an asset going forward as we move forward into the phase of vaccination and then rebuilding post-COVID?
Well, thank you for that question, Carmen. And let me one more time echo everybody else and say many, many congratulations to you. I think that your question is about the community, about resiliency in our community, and about how we move forward with vaccination. Is that correct? Okay, good. So with that, I know that Pat Allen talked at length about what was going on at the Oregon state level, and I had some comments there, but I think we understand how the state is approaching this and what their focus is on the BIPOC community. So I wanted to talk a minute about the fact that in Washington County, again, we've been working with the Coalition of the Communities of Color to get feedback from all of our different community-based organizations to make sure, and we've talked about this repeatedly, that this message has been out there, to get feedback about what do you need to be able to be comfortable getting a vaccine? What do you need? What information do you need? How do you need to receive it? Where do you need to receive it? And that's the essence of the questions and the communication that's going on right now. For example, in talking earlier today, perhaps there is going to be an opportunity, and Wajid, I'm just throwing this out there, but maybe there's an opportunity for a vaccination clinic at the MET on Shoals Ferry, separated men and women, and recognizing what the cultural specific needs are of that organization.
We'll be honored if our director of OHA will be funding it. We'll be blessed, you know.
We will. Well, that's the type of communication that we need to have. Jawad and I talked a little bit earlier about that. But at the same time, what we need to do is understand, for example, that there is concern in the Muslim community about pork product in vaccines. So how do we communicate that? Is that these vaccines are safe, and what the vaccines are made of? How do we effectively understand what the issues are, and then communicate what it is that we are doing to address those issues? The ERCO is putting together an advisory committee of communities to discuss the issues in the immigrant community as well, so that we understand those. There's a fear that employers are going to require vaccines for you to keep a job. How do we dispel those types of rumors? How do we address those things? And at the same time, as Marcus was talking about earlier, honor the science behind this, honor and communicate what the science is, because that's how we will move to a safer community for everybody. The other piece that I wanted to talk about is just quickly, the vaccination piece is a part of a continuum of how we've been dealing with this pandemic. We learned so much through the testing process, through the information, through things like, we learned that we needed to go to our migrant camps to help establish testing protocols, to bring communication, to help establish things like washing stations and those types of support for our migrant camps. We worked with Virginia Garcia on the testing and how that testing was available to our Latinx community, through, again, the Latino Network, and also through Centro Cultural. So the communication piece, I believe, is one of the biggest pieces. But to get to Carmen's question about resiliency, the relationships are so key to being resilient as we move forward. We need to learn from this. We need to learn where our weaknesses have been. We need to learn how we can build alliances and bridges so we can support into the future. I've been a part of the business recovery piece of the CARES relief funding for Washington County, and understanding what our small businesses and our medium-sized businesses need to survive. Understanding and communicating that daycare is a business issue. It's not just it's a family issue. I don't mean to say just a family issue, but it's so important to communicate that this is a business issue as well. We need to support our daycare community. We need to be able to provide those type of services to all of our residents. So in terms of resiliency, Carmen, I believe that we have learned important lessons along the way. I've learned lessons. I know all of us at the county have learned lessons, but the trick is, how do we retain those lessons and use those learnings into the future? So I'm hoping that all of the people on this call will be reminding those of us that have the opportunity to initiate programs, to start different ways of doing things, remind us of those things that we have learned. So again, quick thank you and a shout out to MET. You're doing a great job, and so much appreciated that you're.
Thank you. Thank you so much. And if folks would keep their eyes out for Nafisa, let's ask Oregonians and Oregon Live's Steve Dean if he would ask his question in place of Nafisa for the present, because I know Steve has other places to be. And if you don't know Steve, he's been giving voice to our neighborhoods, to our families, to our households for 41 years at what used to be Oregonian, is now Oregonian and Oregon Live. And he has changed lives. He hasn't changed families' lives, neighborhoods' lives. And this is what journalism really is intended to do, is to notice where government is failing, where our civil society is failing, and even our faith associations are stumbling, and make news of that. Steve, would you mind jumping in from the back of the list to the front of the list?
Yeah, I have, Pat, good to see you, by the way. Had two quick questions for you. What is and they're very basic, what's the basic timeline for vaccine distribution in January and February, almost upon us? And by the way, if I'm one of the many Oregonians who's had COVID, should I get vaccinated?
Yeah, so let me take the second question first because it's the easiest, and the answer is yes. And without getting into a ton of detail, the nature of these vaccines, it's new technology, nobody panic, but it's not the kind of the typical, you actually get exposed to a killed version of the virus or something like that. It actually, the first two vaccines that have come out cause your body to react to the proteins that are the spike on the crown that is the coronavirus. And what it actually does, particularly with the second dose, is cause an even greater immune reaction than exposure to the virus itself does. And so what the experts are saying right now is, yes, you should get vaccinated even if you've had the virus. I went to that one first because the answer to the second one is a little more complicated. We've received so far about 150,000 doses. That's enough for about 75,000 people because both the vaccines we're receiving require 2 doses, 3 or 4 weeks apart. And our ability to vaccinate is ramping up. We're starting with hospitals and skilled nursing facilities, as I talked about earlier. There's about a 3-day lag in reporting when the vaccines are received. So far, we've had reported to us about 25,000 vaccines. I'm sure that number is higher because of the lag in vaccines that have been given and haven't been reported yet. Our peak day so far was yesterday at about 5,000 vaccines. But again, I'm sure that number is probably closer to 6,000 or 6,500 vaccines, and that number will keep ramping up. It's a little behind where it would have been because of the holidays. 11 people got vaccinated on Christmas because it was Christmas, and nobody wants to sign up for that, right? So that's the ramp up piece of why it's hard to answer. Then the other part that's hard to answer is how much vaccine are we going to get every week from the federal government? And until today, we had no idea how much we were going to get at all starting next week. Well, today we learned we're going to get 85,250 doses if everything that's been promised shows up. That's been a little bit dicey throughout the pandemic, whether you're talking about personal protective equipment or testing supplies or anything else. What the federal government says is going to come doesn't always come. It's a little better so far on vaccines, but not great. There are between 300,000 and 400,000 people in category 1A. And so based on where we are right now and the doses that we've received, I think we're going to be into February before we're able to move on to educational employees, which is the next category, at about 75,000 people, which is about 2 weeks worth of supply. Now, I'm using a data point of 1 week of new information to kind of give you an idea of where I think we're going to be, and that's really dangerous from a projection standpoint, but that's kind of the very best information we have right now.
Okay, thank you. Jody, would you take over, sister, with the next question?
Yes, thank you, Director Allen, and you answered so many questions, especially the question regarding if you did get COVID, should you get the vaccine again? And it's very important for our communities to know. Thank you so much for answering that. I have Donna Maxey, the founder of Race Talks, who is going to ask Commissioner Sushila Jayapal a question. Donna Maxey.
Okay. It has been answered, I do believe, but I do want to still ask Commissioner Jayapal and to kind of frame it a little differently. The question was, immigrants, refugees, people of color, and other marginalized groups are overrepresented in industries such as food processing and transit, and basically in jobs impossible to do from home. Will they be prioritized in the vaccine distribution process? And I want to personalize that somewhat by saying I have personally experienced this because here in Oregon, the African-American community is not as heavily impacted, but I have friends in New Orleans who have had it and have passed. And I have a friend who has had, who got it in March and has had someone that she knows, including her husband, every day pass since March. So it's really taken its effect. And my own mother, who, God bless her, was 101, had it. There were community workers there who are people of color and poor white workers. And 3 of the people in the home, there were only 5 people in the home, and 3 of the people in the home contracted coronavirus. So, you know, will these workers be, especially in the health system, will these workers be given priority in this vaccination?
Thank you for the question, Donna. And yes, you know, I think several, if not all of the speakers have talked about the fact that one of the reasons that Black, Brown, immigrant, refugee communities are disproportionately impacted is because of their role in those both frontline and essential worker jobs that both increase the risk of their catching the disease and increase the risk that when they go home, they transmit it as well. And I think the question has to a large extent been answered by Director Allen. As you heard from him, that prioritization, the specific prioritization framework is being set at the state level. And there is more to come in terms of what happens in the next phase of the rollout of the vaccine, especially that specific essential worker category, which is the category that the community advisory group that he talked about is going to address. You know, I think what I'll say from the county perspective is that we will, I think, and I might ask Jessica to jump in here as well in a minute, we will layer whatever the state framework is that's developed with the types of strategies that we've already employed to prioritize BIPOC communities that have been successful. So for example, that means I mentioned that we've got a clinic, North Portland Clinic, where we do COVID testing. We also do flu vaccination at that clinic. And so we pair flu vaccination with testing, and we have focused on Black and African immigrant communities in our outreach for that site. So, you know, we have in our contact tracing, we have focused on outbreak sites where we know that there's an outbreak happening, and we put resources there. We have set up our testing sites based on geography. So things like geography, identifying places where there are outbreaks, you know, the strategies that we've used essentially as ways to focus in on BIPOC communities, I think will likely continue to be paired with whatever the framework is that the state comes up with. I'll stop there. Jessica, anything you want to add to that?
Yeah, I would just affirm, and I mentioned this earlier, this is part and parcel for how we've been running public health for the last several years, even before COVID. The mechanisms that I talked about before, we will continue to do while the state advisory board is developing strategies, because ultimately we have to implement a lot of this locally. So we have to have local plans in parallel with the state. It can't just be a one-size-fits-all approach. So that's where that community engagement that I spoke of earlier needs to restart. That specifically happened through, again, my former boss, Director Banks, and our chair's office. But additionally, we have a local public health advisory board that we've worked with the entire time that we've been in this pandemic. And this is a diverse group of community members that we go to routinely, again, outside of COVID-19, to really work through these issues, because as everybody is raising, these are what I would call hyper-localized issues. You have to be working in community constantly to operationalize these decisions and to sort through what the decisions even are. So like I mentioned, we plan to do that and be sort of marrying those strategies together over the next month or so to ensure that we're reaching the right folks.
I will jump in and add one more thing. You know, the examples that Veronica provided, thank you, Veronica, for those examples about barriers to access to testing, for example. I think what they tell us is that universal general strategies don't work in order to reach our most underserved communities. We've got to have very specific, and other speakers have talked about this as well, very specific strategies that respond to specific needs and specific groups in our communities. And so that again is what we've tried to do and what we will try to layer on top of whatever the state strategy is.
Thank you, Commissioner Jayapal, and thank you so much, Sadara Jessica. I can never say your family name, but I'm working on it. But if you folks would please take a screenshot of Donna Maxey. She is one of those elements of living history. She's a retired educator, and people listen to her, even if she gives them bad news, even if she's grumpy, which educators tend to be, fourth grade educators, especially after they retire. But people will listen to what she says, good news, bad news. She's one of those people who really need to carry your messages. So if you don't know her, love her next week. Living history. Okay, can we move on now to Kesa Jama? Kesa, my brother, thank you so much for being as patient as long as you have. And I'll tell you shamelessly that Kesa Jama, although he's my younger brother, is my hero. He has done everything that we ask ourselves to do. I mean, 12 people in each community, from being a community mechanic down there around people's kitchen tables to the state legislature in Salem, running for office, for heaven's sake. What an awful idea that would be. From the intercultural, goodness, I can't remember the name of your organization before, Unite Oregon. But Case has set up one of the sort of from the ground up nonprofit organizations done on his own time, weekends, evenings, and we love the brother for this. So Case, if you wouldn't mind, Pat Allen is going to get clobbered one more time by one more question.
If you don't mind, Brother Casey, Sister Nafisa is putting her kids to sleep. She's back, to give her just, if you don't mind, Brother Casey.
Please, please.
Commissioner-elect Nafisa Fai, Joria or Polo, you introduced her, or?
I think Joria,
I'm right here.
She did introduce her, yes?
Yeah.
Hi, hi everyone. I think Brother Polo dubbed it right. I was putting kids down. You called it. And soon to be Senator Casey Jama. Hi, hello, my brother. I can't wait to celebrate you in January on your appointment. So I'm excited, and thank you, Wedgedy, and thanks to everyone for being here. And I've been listening and really appreciate, and we'll definitely take back what I heard to the communities. As a newly elected, communities of color person, I've been getting a lot of questions, especially around COVID. And I think some of the questions I had, one was already asked, which was, if you've gotten already COVID, do you really need to get the vaccine? And then I think you answered that, Patrick, and we'll definitely make sure I take back that answer. And then the second part to that question was, is the vaccine really required for everyone to get? Is it going to be mandated, something that everyone has to get? And then the other question that I had was, we see a lot of images of people who get the vaccine, and it's sort of painting a picture of the haves getting the vaccine currently, and then communities of color and other communities, the low-income communities, and then the real workers who need it are on some tiers down the list of priority. So people have been asking me, will everyone get the same vaccine? And how do we really know that the ones that are currently getting the vaccine right now, everyone will get the same exact vaccine? So that was a question that I didn't know how to answer. And I tried to look, some information about it. And so that will be really good if, OHA can put out some information about the vaccines, and if everyone is going to get the same vaccine and same dose. And then the other, I'll just layer on, sorry. I think the last question I had was, yes, communities of color, there's going to be really a strong, it's going to take a lot of work to build the trust for a lot of communities to be able to either go to their clinic or, stand in line to get the vaccine. So I'm wondering, when will that trust building strategy start, and how are you planning to do that? And what kind of community leaders that are trusted that you're going to deploy, so that other communities know, get a heads up that this community leader is trusted to spread the message, and that they actually have current accurate information about the vaccines. So I didn't know, who are the community leaders who've been trained, if so, to spread the message around, this vaccine is safe, nobody is being used, no history is being repeated, things like that. And then also, on top of the communities of color and the lack of trust, there are a lot of moms and parents, actually not just moms, parents with kids with autism that are on the fence around vaccines. And then, so I'm also wondering, how do we including that community as well into the trust building? So I'll stop, and then I think stop right there.
Would you like me to try to blow through a few of those answers as quickly?
Sorry, Patrick.
That's all right.
I should have just asked you one at a time, but I know there's a lot of people waiting to get a piece of your suggestions and what you have to say. So I thought I would layer on.
Yeah, no, that's perfectly fine. So I'll, as quick as I can. No, people will not get the same vaccine. There are different vaccines out there that are going to be used in somewhat different ways. Anthony Fauci, for instance, when he got vaccinated a couple of days ago, got the Moderna vaccine. Others have been getting the Pfizer vaccines. The biggest difference that will cause people to get different vaccines is the storage requirements for the Pfizer vaccines. They have to be kept at 94 degrees below 0 Fahrenheit. The Moderna vaccine needs to be kept at about 0 Fahrenheit. Other vaccines that are coming have even less cold storage requirements. And so the less finicky the vaccine is for storage, the more likely it is to go to more rural communities. Now, the super good news between the Moderna and the Pfizer vaccines is they're almost identical in their effectiveness, 94.5, 95 point something. And the indications are that the next vaccine coming down the pipeline, the AstraZeneca, is also in the 90%. So I think rather than focus on which vaccine is it, it's focus on how effective are they at being able to treat disease. It'll get trickier if we end up with a vaccine that gets approved at something like 70% effective. That's a very effective vaccine, but the perception is going to be that it's not because of the way the numbers work. And so we'll have to figure out how to deal with that. Will the vaccine be required? The state at this point has no plans to require vaccination. The vaccine is not approved in kids. There are some people who were a little bit whipped up about a bill from the last legislative session eliminating some exemptions for kids, for their parents to exempt kids from getting vaccines. But the youngest age the vaccines have been tried in, the Pfizer vaccine is approved for 16 and over. There could be a point in time where certain employers could require their employees to get vaccinated. And a good example would be people who work in nursing homes, who, if they're not adequately protected, are putting very frail people at grave risk. And so you could see a circumstance like that. I'm not aware of anything right now, in the works on a point like that. Your trust building question is a great one, and it's as much I think the county partners as it is the state. We think that the advisory committee we're building and reallocating that power to that committee to make decisions about the vaccine is sort of a key building block in that trust building. We think the work that we've done to help fund community-based organizations in all kinds of parts of the state, serving all sorts of communities as a piece of that. And then as we roll out to deliver vaccine to a variety of populations, that intersection between state and local public health, relying on those partnerships that they're the ones that on the front lines working with, I think will be a key piece of how we continue to build that trust. And then the messaging that I talked about a little bit earlier, I think is another important part. Who's out there saying you should get this vaccine? I'm hoping everybody on this call tonight will be out there telling people in their communities you should get the vaccine, because you are the community leaders who are trusted voices who have relationships who people will listen to, and I think that's the kind of relationship building that will that'll help with that. How was that for 3 minutes worth of answer for 3 questions?
Thank you. Yes, that's very, very succinct and very good. Thank you. I appreciate it. I don't, I'll give other people opportunity to ask other questions. I do want to give a shout out to Jessica Guernsey, my first boss when I was doing the needle exchange, and I was a volunteer in that program. Hi, Jessica, and congratulations.
Hey, congratulations to you. I was wondering when I could break in to say hi. I was hoping to get to see your beautiful face live.
Thank you. Thanks, Jessica. Good to see you.
Okay, now let's move to Kesa Jama. He was going to crush Patrick Allen like an insect with the final question of this evening. And while he crushes Director Patrick Allen, for folks who are on in the audience, here's your chance to ask questions. Just do it quickly and make them short of any of our speakers or panel members tonight. Okay, Kesa.
Before Casey Jam goes back, I just want to say that I do have a few more questions for Director Allen, so you're not off the hook yet.
Yeah, so don't move a muscle.
I'm not going anywhere.
Okay. Casey, you're on. Jump in quick before one of the sisters jumps in and interrupts you.
Thank you, Paulo, and thank you, Nafisa, for your kind words, and thank you, MET, for organizing this amazing discussion. I really hope that maybe we can actually do round 2, and hopefully the elected officials and the director of OHA will commit to coming back another session, hopefully maybe so the community members can really have an opportunity to get Q&A with the community, and so they can ask you direct questions that they have. And maybe facilitators can, we can just, listen and just be part of the conversation as well. Because I do want to hear from the community. I think that's really important. With that said, I want to also congratulate both Commissioner Fye as well as Commissioner-elected Carmen Rubio for their election, and that's a historic moment for our community. So thank you, both of you, for your services. Director Allen, my question to you is about timeline. It's about actually where. So let's move to the third category, which is about the general public. If one is we go to the 2 categories that you described, the first being the frontline workers, and the second group will be the education group. Once we move to the third group, which is about general public, where do you think that, if you have any information about where communities can get the vaccination? And particularly when asking that question, I don't know the dynamics around whether community-based organizations like MAT, Latino Network, Urban League can be a host of those kind of services if funding provided. But that's just kind of, if you have an idea where can be vaccination will be provided, I'll stop there. That's my question to you. Thank you.
No, great question. And it's going to vary depending on where we are in that prioritization. When you get all the way to priority level 3, which is the general public, at that point, there should be enough vaccine that is really no different than getting a flu shot. And you can get it at a practitioner's office, at a pharmacy, at special clinics that are set up to target flu shots, and it becomes widespread and it's pretty much everywhere. The more challenging part will be kind of in the middle. Right now, we're focusing on hospitals and long-term care, and those are what we really call closed pods. Someone brings vaccine to a place, and you are part of that place, and you can only get vaccinated if you work at that hospital, or you live in that nursing home, or you work at that nursing home. We then move to what are called open pods, which are places where people who meet a certain criteria can come and get vaccinated. And that may be a hospital, that may be a community-based organization, that may be a federally qualified health center. And that's where the partnership between the state and local public health will come to play, because that'll vary a lot depending on what community we're talking about. That'll look really different in Umatilla County than it will in Northeast Portland or in rural Washington County. And so what we're working on right now are developing these plans for what are these focus populations going to be, and as their prioritizations come up in this process, who are the partners that we're going to work with at the state and local level to be able to get that vaccine out. And so I would say, I got a separate communication from the trust while we were talking here about wanting to be a partner for that. I think we at the state level and county government, we will be actively looking for partners to help organize and arrange and facilitate these open pod kinds of vaccination opportunities. So it's really going to kind of depend on where do you fall out in this prioritization. It'll be the very easiest when we get to the general public, because there should be a lot of vaccine available at that point. I can't tell you though exactly, at what point on the calendar we'll be at that. And I would maybe look to Commissioner Jayapal or Commissioner Treese or Director Guernsey to see if you want to add anything to that, since you're really on the front lines for that.
I think I would repeat a little bit of what I said in the first answer, which is that, like the North Portland clinic that we've set up with a partner organization where we're doing vaccination and COVID, that is the way that we would be able to roll it out at that point, and maybe even sooner. But it is more likely to happen at the stage that you're talking about when we're rolling out to the general population. Jessica?
Yeah, I guess I would just add to Pat's point. I think a point that I think is really important for local and state public health is what we call an assurance role, which is really leveraging our partnerships through systems that really have the ability to provide multiple venues for vaccination. So I think that's an important piece here throughout the whole journey, not just at that sort of tail end when we have general community vaccine available. We are going to need to leverage these systems to be part of the solution. This is an unprecedented undertaking that will require that. And it's both in terms of, working with partners to operationalize this, but also to hold us accountable as a system around making sure we're paying attention to the data and those that are highest risk for illness and or death. So that is part of what we need, what we're doing right now, and what we need to continue to do.
Yeah, and just to give you a sense of scale, we've vaccinated so far across the state about 1.2 million people for flu, which is pretty good. We need to vaccinate more than 3 million people twice for COVID. So it's a whole different ballgame. I'm sorry, Commissioner Treese, I think I interrupted you.
No, that's fine. Thank you. I would just add again that working with our community-based organizations, working with groups like, again, Virginia Garcia, groups that have the stand-up capability right now and have done a great job through our testing protocols, are the groups that we'll be leaning on. The other thing that I just wanted to mention is that we are working on protocols with our Metro West ambulance company, with our fire departments, with all of the city managers, so that we have all of the strategies in place to be able to administer, which would give us the flexibility to go on site to places when we're in that phase, at the last phase that you mentioned. So thank you for your comments.
Thank you, Director Allen, Commissioner Jayapal, Commissioner Treese, for this answer, because as you know, Muslim Educational Trust is one of the organizations that is always at the forefront of helping our communities, not just Muslims, but everybody else. And we would be more than happy to be part of this this program. And, perhaps Brother Wajdi and y'all can, talk about this and discuss it further, because, also, when we talk about the biopics, but we also talk about the Muslim members of the Portland community or Oregon community, they want to go to a place where they are trusted at an organization, where they know the people that are trusted. And when they do see the leadership of that community working towards getting that vaccination or that program, they would rather come to that Center for Vaccination. So we will be more than happy to work on that. Another question that I wanted to ask Director Allen and even Commissioner Treese and Commissioner Jayapal, or even Jessica. Again, I will not try to attempt to say your last name, Jessica, sorry about that. If there's a cost to the vaccination, and or how is that going to be handled? So that's one of the questions as well.
So the vaccine itself is free. It's not free. It's been paid for by the federal government. There is potentially an administration cost, so a cost for the actual delivery of the vaccine, which is covered by the Oregon Health Plan. It's required to be covered by commercial insurance, by self-insured plans. And if you neither have Oregon Health Plan or commercial insurance, then it's required to be administered at no charge. Now, these systems we all know sometimes break down and get get a little bit weird, and so there may need to be some troubleshooting around that. But the intent is for nobody to have an out-of-pocket cost, even if their insurance may be paying something to the provider who provided the vaccine. Does that make sense?
Yes, thank you. With us today is Maria Rubio, who is the, and I am going to, president of the Centro Cultural of Washington County. Ms. Rubio, if you'd like to add any comments to our program, or to Commissioner Treese, to Director Allen, or to Commissioner Jayapal. Ms. Rubio?
Yes, thank you so much. And thank you everyone, Brother Wajdi, for putting this on. My question is actually for Director Allen and Commissioner Treese. I know Multnomah County has been doing this for quite a while, but as has been said already, the pandemic has surfaced disparities in the service delivery to communities of color. But I think also it has surfaced the strength and resiliency of culturally specific organizations. Director Allen talked about the millions of dollars that have been put out to CBOs to do the work during the pandemic. And I guess my question is, how systemically will this change? How will you sustain continuing to partner with us as culturally specific CBOs to continue to be a partner with you in the work, not only in health, but in housing and in workforce, and in giving us direct contracts instead of having to contract with the usual suspects, so to speak, and then we would have a subcontract. So this is kind of moving into that systems area, but for those of us who have been participating and have really, helped and really reinforced our internal infrastructure to respond, really appreciate this. And we really would like to continue working with you as partners.
Well, let me go ahead and take a first crack at that. I mentioned earlier OHA having a strategic goal of eliminating health inequities in the state by 2030. I didn't talk about the fact that that's actually been part of a year-long strategic planning process that got kind of cut short by the pandemic that we're going back to and picking back up again. But it really has led to a sort of a foundational reimagining of how we do almost everything as an agency around what does legitimate community engagement look like, who are the partners that we need to work with, how do we, back to this notion of allocating and reallocating resources and power, how do we actually do that from a practical standpoint? And I mentioned very briefly that we have a proposal in the governor's budget to continue these grants to community-based organizations, continue health equity investments as a part of an ongoing commitment that beyond the pandemic, we need this to be a foundational way that we do all of the business that we do. If you then kind of marry that to really esoteric stuff, but the CCO 2.0 work around social determinants of health and health equity, and how we're trying to do the very things you're talking about of marrying up housing and food security and those issues, and how we make investments under the Oregon Health Plan that support those functions. I think what we will come out of the pandemic with is this relationship with CBOs and with the community that becomes the cement that ties that stuff together in ways that if we just went off and used the existing, frankly, structurally racist structures that we had been doing all of our work through before, we would never have really gotten anywhere with this. And we've now got a basis through these relationships to really change the nature of that work.
Thank you.
Thank you.
Maria, this is Pam again, and I just wanted to say that I do believe that we've learned some very important lessons through this process. As I said earlier, that our relationships with our CBOs in Washington County, as you are well aware, we have extensive relationships with our CBOs in delivery of services and all sorts of different things. But I think we've learned some important lessons about the need to tie those relationships even closer together. So thank you for your comments. I appreciate it. So, and by the way, I'm not just saying that as a member of your board of directors.
Thank you, Pam.
Thank you. Thank you. I do have a few more questions that were asked in the chat. And one of them is actually a very important, pertinent question regarding education. How will Governor Brown encourage schools to open in February, especially that would impact the BIPOC communities, both in terms of risk of COVID and in terms of prison pipelines where tensions will be higher in post-COVID school environment with health safety concerns? And the other question was how about the farm camp workers and how will they be vaccinated? And if there are any funds that have been, special funds that have been allocated for BIPOC communities, and how will that be prioritized? Director Allen and then commissioners, if you don't mind jumping in as well.
So again, I'll take the easiest question first. The federal renewal of the CARES Act that finally just happened does include resources for vaccination, and so we'll be able to prioritize those similarly to the way that we prioritize the populations that we're working to get vaccinated. In terms of the school question, yeah, we'll take the school question. Governor has identified school employees, again, broadly, not just teachers, but people who come in contact with kids as the next priority after we get through healthcare and long-term care for vaccination. We're going to work very hard to line up the timing around how that happens. If we're short on the timing, my own preference would be that we try to focus on the districts that disproportionately serve communities of color and lower socioeconomic status kids, and get them vaccinated first as we work through those 75,000 people. Now, 75,000 people is not a ton. It's, as I said before, it's a couple of weeks worth of vaccines at the rate that we're going to get vaccines out now. But there is going to be some tension around that if districts try to aggressively open before we've been able to finish that process of vaccination. I didn't quite follow the prison pipeline element of that question. Could you help me with what you're trying to get at there?
That question was sent to me, and now the question I have lost the right here. Sorry, just give me a minute.
Yeah.
So yeah, it looks like it's very, and in terms of prison pipeline, when tensions will be higher, so I think they were trying to ask about what will happen in the prison population. I believe I think they were just combining two of these together.
Okay. Got it. So we've not made decisions yet about where adults or youth in custody will be prioritized in the vaccine. That's yet to come. And then I just remembered the third part of your question around migrant and seasonal farm workers. That's a great example of the kind of a thing that would be most effectively done working with open pods and local public health and community-based organizations to identify events going to sites, at camps, those kinds of things to work on that. That's a population I would expect to be prioritized fairly high in the critical worker piece of in 1B, just based on the disproportionate impacts that we've already seen in those communities throughout the pandemic so far.
Thank you, Director Allen. Is there, I know that the Oregon Health Authority and the state of Oregon has set up all of these. Where would, if somebody wants to read up more on the distribution of the vaccine, the type of vaccines, where would you recommend them to go besides the CDC's website?
Yeah, we have a website, and I'm just looking over here at my computer. If you go to covidvaccine.oregon.gov, and I'll put that in the chat too. We have a collection of all kinds of information about the vaccines themselves, about the testing process, prioritization, the Vaccine Advisory Committee, all that's at that site.
Thank you. And another question regarding vaccines is, as of right now, the vaccines are safe for 16 and up or 18 and up age. When are we expecting any vaccines that are going to be safe for children under the age of 16?
Yeah, so Pfizer is 16 and up. Moderna is 18 and up. I've not seen ages on any of the other candidates that are out there. My understanding is that a number of manufacturers have been enrolling kids and I think pregnant women, which is another category that's not been tested. And there's some general speculation that they may be able to gather enough data to pursue licensing for those populations sometime this summer, but I think that's all real speculative. I don't know. I'm seeing Jessica Guernsey nodding. Have you got more?
No, I think you're capturing it correctly. I think that is what I have learned as well, and I know that raises a whole host of other questions with regards to the previous question around schools. I think Commissioner Fay had a comment about, concerns about impacts on children, and we're definitely getting a lot of questions locally around that we do have to wait for some of these answers once we see how this rolls out with especially younger populations.
Thank you, Jessica. Thank you.
Joria, if you don't mind, we exceeded the time. We will have another 11 minutes if everybody doesn't mind. Jessica, there is a question for you, my dear, to Jessica Guernsey. What are the strategies in Multnomah County specifically, will you use to ensure equitable access to the vaccine by minority communities? Please be specific when identifying the strategies. And then the second question from the same questionnaire, how will you get the factual information on the vaccine to these communities, since disinformation and misinformation are currently rampant in Oregon or Multnomah County minorities?
I might have to ask you to repeat that second part, but I'll start with the first part. The strategies that we're looking to build on specifically around the equitable distribution of the vaccine for BIPOC communities in Multnomah County really builds on the testing strategies. As I mentioned, we are working within a state framework right now, and we understand that the advisory group is going to be looking at different pieces around how we will prioritize the next phase of work, and we will do local engagement to ensure that our data and the strategies that you all are articulating are reflected in that, and that we marry those. So specifically what that means to me is that we're gathering input from the groups that we have been working with to understand the issues that you all are raising, and that we're planning ahead for multiple ways to administer the vaccine, because on an operational level, we can't fully wait for everything to be decided sort of at a large scale before we start to move forward in partnering with folks that we've already been working with on the testing strategies to build out the vaccine work, if that makes sense.
Yeah.
So we're really looking to build off of that to create avenues for vaccination. But again, we also need to work with our healthcare partners. These are systems where we definitely need to be working with them to ensure that not only are they administering the vaccine, but that they have a strategy that is in concert with what we're seeing with our local communities. So that's more of like an accountability and an assurance strategy because folks have a responsibility to be part of this solution. So that's sort of how we're envisioning it, if that makes sense.
The second part, and Director Allen can also answer the first question. The second question, Jessica, how will you get factual information on the vaccine to these communities since disinformation and misinformation are currently rampant in these minority groups?
Yeah, absolutely. That's a great question. The information flow is extremely challenging in this day and age. I have to say my children laugh at my understanding of social media, and I admit I'm not completely fluent in it, so I will just own that. But I would say that, and again, just want to acknowledge the amazing partners that have been doing our community liaison and culturally specific communications work for the last year. This is a robust group of folks that have focused on doing exactly what you're talking about, which is working through trusted community partners, funded community-based agencies that are funded both through the county and the state to ensure that we are in bi-directional conversations about addressing myths, issues, facts, questions regarding the vaccine. So Commissioner Jayapal mentioned we are standing up a regional BIPOC vaccine communications group that is in concert with many community-based partners to do exactly what you're talking about. We know it is not going to be an easy task. It wasn't before COVID when we had and continue to have questions and issues regarding vaccine safety and efficacy. And that's where we're engaging now on that.
One of the strategies, if you allow me, in my early age here in Portland, I remember that the late dean, the founding dean of the College of Urban Planning, Nuhad, under the urban planning, the School of Urban Planning that is named after him, Nuhad Tolan is one of the founders of MET. We used, when we wanted to defeat, smoking in Portland State campus. So we were able to use religious sermons, in the Arab churches and Muslim mosques, and other people of faith. We, Rodney Page was the executive director at Ecumenical Ministries of Oregon. So we got the Jewish community, the Muslim community, and Christian community and Catholics, to do religious sermons, to educate, of the disadvantage, of smoking and the possible cause of cancers. And we were able, to defeat, all campuses, became smoke-free. This is my lifetime here in Portland, Oregon in the early 90s. Would you, Director Allen and Director Jessica, would you be interested, to building coalition? We have Pastor Hennessy here. He's a co-chair of Ecumenical Ministries of Oregon. And I think it would be nice, to heal and unify our public square and bring the faith-based organizations, even though MET identifies education and cultural, but we have, 14, mosques, and 3 Arab churches, from Coptic, from Eastern Orthodox, from, all of, and Catholic, Maronite, and so on. Pastor Hennessy, what do you think of this idea?
I always say yes to you, Wajdi, no matter what. The answer is no, I totally agree. We stand ready and look forward to further conversation on it, but absolutely yes. And again, as you know, our community, my community, certainly as I see Marcus and Donna and others who are here, this is going to be a real challenge. And I have said as a clergy person that when it comes time for us to do this, I want to create a certain amount of media and education around us as clergy and other leaders in the African American community to come together and actually take the vaccine. And I say this, my friends, as one who took a flu shot 15 years ago and swore I'd never take another one, and haven't, and did not, in fact, plan to be a one who would take this vaccine, but my mind has changed a lot. I think the science is great, and I absolutely think that we should be doing this. And I'm grateful for all of you tonight being here together.
Pastor, it's not too late for me to get you hooked up with a flu shot either.
Thank you, Director Allen. I appreciate that, brother.
But imagine, Director Jessica and Commissioner J. Paul and Director Patrick and Commissioner Pam Trees, imagine you line up, in the beginning of the year, to defeat, the fear, lineup of rabbis and imams and pastors and nuns, and celebrate, these great achievements that, for our information, the two scientists in Germany, they are Muslims, Turkish, the head of the, of the COVID-19 task force is a Muslim from Morocco. What a beautiful immigrants, contribution to the healing of the world. And imagine these religious leaders line up under your leadership, Jessica and Patrick, to celebrate such an achievements. We will defeat the fear, we'll defeat and bring doctors, Muslim doctors, Christian doctors, Jewish doctors together, and celebrate such a thing. Just an idea to think about. And we'll be happy to be rallying in your behalf, in the left and the right and the front and the back as well,
Religious leaders are people that we trust, and the messages have to come from people that we trust. So I think it's a wonderful idea. Thank you.
I think so as well, Wajdi. Thank you for that idea. And, I'll note, Jessica mentioned that we have this robust team of community liaisons, and one of the communities that we have liaisons to is the faith community, recognizing how important it is. You've given an example of a demonstration of people lining up to get the shot, but the messaging, the communication, faith communities are such an important way of getting that messaging out. And that's why we've had consistently from the beginning liaisons to our faith communities as well as to specific immigrant and refugee communities. So thank you for that idea. I think it's wonderful.
We know we are late, but if any of the public wants to ask any questions, we'll be happy to entertain 2 more questions.
Can I ask a question?
Please identify your name, Ali, and your organization, please.
Okay, my name is Ali Ibrahim, and I'm from South Center, which means Somali Oregon Service Center. And my question tonight is, how do we need to address to our community safety lessons about the COVID-19 before they take the vaccine, and how?
Anybody can answer that question.
I'm sorry, I didn't hear the word before lessons. What kind of lessons?
I say, do we need to address to our community safety lessons about COVID-19 vaccine before they take the vaccine, and how?
Yeah, I think that's a really great point. And as we know the data today, and the safety testing has been extensive for these vaccines, with tens of thousands of people, overrepresented communities of color and the elderly, which is unusual for vaccine development. There is a good safety record for the vaccines. That said, there are side effects, and the side effects are maybe a good bit more than average for particularly the second dose, is what the best information is. That what we've seen from CDC is that something like 1 out of 10 people will feel like they need to take the next day off with body aches or fatigue or those sorts of things. So, not that you're as sick as you would be with COVID or anything like that. But I do think we should be honest with people about that and have that be part of the education about the vaccine, so that we don't have a lot of really unhappy people really caught by surprise by that. I think it's a really good point.
I guess I would like to make a statement, and as one whose name's been offered as one to go take the vaccine, I want to tell you, I'm scared. I took the shingles vaccine. They said there was 1 of 4 side effects you could have. I had all 4 of them. So I think the best thing we can do is offer people information so that they can make a good decision, and that folks don't feel pressured into taking a vaccine publicly. I think that some of our lawmakers have been provided, kind of pressured into doing that. And I had to wonder how many of those vaccines had water, because I know that there are some who would be afraid to step up and take that shot. And I'm telling you, I don't want to take a shot. I'm just going to be honest, but I would be more than happy to step up and help give information and route out information for folks. So just
So I have a personal interest in asking you, were the side effects after the second shot? Because I've had my first, but not my second on shingles yet.
Oh, no. This was the first shot. And I called up friends of mine and said, what side effect did you have? And since there were 4 side effects, I called up 3 friends. None of them had side effects, so I got them for everybody.
Well, bless you for that.
With that, we conclude our night with peaceful wishing and a great coming year with a great new president. And we hope that our president-elect will ban the Muslim ban, as he promised. We congratulate all the new elected officials. We ran a hefty campaigns for first time in this history of Oregon for Muslim candidates run for an office. All of them are winners. And we defeated Islamophobia. And we are going to defeat all kinds of bigotry and divisions within our society. Remember that we are all the colors of God, and in Islam, we don't condemn any color. We address systems, and we try to engage in a loving, caring way. Commissioner J. Paul, I love you dearly from the bottom of my heart. You know that you are my dear sister. And Commissioner Pam Treese, I love you dearly. You are from the bottom of my heart. And now we have new friends and new brothers and sisters. Patrick Allen, we thank you very much for your time and your engagement. And my beloved Jessica Guernsey, your name isn't easy to pronounce. I don't know why there are people having difficult time, but and all the partners, Rest Talk, Donna Maxey, we love you dearly. Vancouver Baptist Church, thank you very much, Pastor Hennessy. And my beloved brother, the president of the Coalitions of Community of Colors, we are the only member in Washington County, the Muslim Education Trust. And we are supportive of Marcos' leadership. We are very thankful to Ecumenical Ministries of Oregon and sponsored the organization to assist refugees, Africa House. My beloved sister Nakengi from the Urban League, she's on vacation, otherwise she would have been here. Casey Jama, we love you dearly, brother. You'll make history. You'll be the first Oregon senator of a Muslim Somali African background. May God bless you and for your leadership. And the Unite Oregon and the Latino Network and Central Cultural, my beloved sister Maria. Today we have the 2 Robios, by the way. This is historical to have 2 Robios in the same webinar. Last but not least, I'm very thankful to my beloved sister Joria Said for being a great moderator, and always the poet and the creative writer, the undefeated champion, Paulo Ronald Catalani. Thank you very much, my dear. And the Pastor Hennessy, if you don't mind, to close with the prayers, if nobody mind that,
Thank you so much. Eternal Spirit, oh, Spirit of many names, as we come to the close of a very, very insightful session together. Thank you for giving us the opportunity to join this community and to be able to ask questions, to get them answered, and to know that we are on the road to a wonderful both education and opportunity to really be able to help eradicate this very, very difficult pandemic. We thank you for all the scientists that were involved, all of those who are responsible for distribution. I want to thank the Muslim Educational Trust for once again being out front, bringing us all together. Thank you for our brother Wajdi tonight and for his great work. And thank you for everyone who's been a panelist, everyone who has been in position to ask a question, and certainly for many of us who have just really sat back as sponges to be able to get as much out of this as possible. Now, what's important as we see this as a mountaintop experience, we must all go back to the valley and do our work and be prepared to roll up our sleeves and to get beyond ourselves and do what exactly Brian Stevenson said in his book, Just Mercy. Be proximate, change the narrative, be uncomfortable, be willing to, and never give up hope. Thank you for our time together tonight, and may everyone be blessed. In your name we pray. Amen.
Thank you very much for the New Portland Foundation for their partnership tonight, and please support, the New Portland Foundation. We are sending an appeal in their behalf. New Portland Foundation would be a great catalyst, to keep our public square conversation. We are a coalition of so many organizations and many individuals, and we hope, to engage, in this coming year in a more effective way. They have been a partner in the Building Bridges. They have been effective, in the Beloved Community Coalition and the census. Thank you very much, New Portland Foundation. And also thanks to our Senator Wyden for being available, and Congresswoman Bonamici. And last but not least, to our Governor, Kate Brown, the best ever, came to us, and supporting us and providing all the support. Thank you very much to MET team and those that work behind the scene. Thank you very much, all of you. Happy New Year to all. Happy New Year.